it's Miss S here. I'm sorry that we can't be together in person for this year's Summer of Explorers, but we decided to go ahead and tell you guys a little bit about our professions so you can kind of get a look into the working world and maybe explore some new careers that you didn't know about or learn a little bit more about the ones that we do. So I just finished nursing school a couple weeks ago, and I will be starting my first full-time nursing job come July. So I'm just going to tell you a little bit about what nurses do, how to become a nurse, where they work, and then at the end I will answer any questions that you guys have. So how do you become a nurse? What kind of school do you have to go to? What kind of grades do you have to get? So first and foremost, you have to make it through elementary and high school. You want to get pretty good grades, somewhere in the A's and B range, just so you can get into college. If you want to go to a bachelor's program, which is typically 4 years, you will need to take the SAT or ACT, which is just a standardized test for you. But then if you want to be a nurse, you kind of have two options. You can do a 4-year school where you go to a college like Penn State or Cedar Crest, where I went to for my nursing degree. Or you can get a nursing certificate or diploma somewhere like Pottsville School of Nursing, Reading School of Nursing, LTRIC, something like that. In the end, either way, once you finish, you still have to take a test and you have the exact same license. So both are great options, just something to look into. So basically a 4-year program, you're in college for 4 years, where a diploma or certificate program, it takes 2 or 3 years to finish, so definitely faster. But a lot of the hospitals are asking that you get a bachelor's degree. So even if you do the certificate program, you can go back to school for 1 year, and basically it takes 3 years to get the same thing that it does 4 years. Just two different options, something to look into. So what do you do during nursing school? You take a lot of science and math and chemistry classes. You take biology, anatomy, physiology, chemistry. You have to take math because you need to know how to be able to figure out how much medication to give to your patients. So basically, like the first 2 years, if you go to the 4-year program, it's a lot of your prerequisite courses. So you have to take all your gen eds as well. And then in my case, the last 2 years were all nursing classes. And then each of the nursing classes that I had a clinical component as well, where I went to the hospital. So I had class one day and then clinical another day. So you definitely learn how to become a nurse, and you get to actually do what nurses really do. And then once you finish all of your schooling, you have to take something called the NCLEX, which is the national licensure exam to become a licensed nurse, which I have not done yet, but I will be doing it soon. So where do nurses work? Nurses can work in a bunch of different places. I think the one most people think about right off the bat is hospitals. There are so many places that nurses can work in hospitals, which I'll talk about a little bit later. They can also work in doctor's offices, schools as a school nurse. Nurses can work in prisons or jails. You know, inmates need people to take care of them too. They can work in hospice, which are for people who are getting ready to move on. Home care, they'll visit your home to take care of you if you need help. They can work at summer camps during the summer. They can work at churches. Some nurses work on the ambulance as a pre-hospital nurse with someone like an EMT. And nurses can also go into the military to work as well. So what's it like working as a nurse? You know, teachers go in normal school hours, whatever, Monday through Friday, like most jobs. But nurses have to be with the patients 24/7, 365 days a year. So typically, at least in the hospital, a normal shift is a 12-hour day. If you're on day shift, you work 7 a.m. to 7 p.m. Or if you're working night shift, like I'm going to be doing, you are working 7 p.m. to 7 a.m. So you're working through the night and then you sleep during the day, which is kind of hard to adjust to, but I'm sure I'll get used to it. Something unique about nursing, though, since you are working such long shifts, 12 hours, you only work 3 or 4 days a week. So you can work Monday, Tuesday, Wednesday, Thursday, and have off the rest of the week. You can work Monday, Wednesday, Friday, Saturday. You could pretty much get to make your own work schedule, which is nice. You get about 2 to 4 weeks of vacation, so you have a lot of time off if you want to. And then, as I was saying, since you only work 3 or 4 shifts a week, you make your own schedule pretty much. So say I work Monday through Thursday, and then I can have off Friday, Saturday, Sunday, Monday, Tuesday, and Wednesday. So like 6 days I can have off in between, and then my next week I'll work Thursday through Sunday and still get my same hours in. So it's really nice because you kind of get to make your own schedule, pick what days you want to work, and you can be really flexible. And if you don't want to go to work one day, you can switch with someone. As long as you get in your 3 days a week, that's pretty much all that matters. You can also work a lot of overtime if you want to, which pays really well. Basically, you get time and a half. So say I make $30 an hour. If I work overtime, I'll be making $45 an hour, which is pretty good. So in the hospital, people can work in different areas. Hospitals are super big. They have so many different units on them. Myself, I will be working in the emergency room, so I'm really excited about that. You get pretty much to see traumas that come in, so people from car accidents, people that walk in and are sick, people from the helicopters that get life-flighted. The emergency room pretty much is where you kind of do the triage system to see if they really need to be admitted to the hospital or if they can go home, or if they only need to stay a couple hours and then can go home. There's also the ICU, which is the intensive care unit or the critical care unit. These are for patients who are extremely sick. Typically, it's 2 patients to 1 nurse, so they really could focus on that really sick patient. And it could be the trauma ICU, the pediatric ICU, cardiac, NICU, which is for babies. There's so many ICUs, pretty much for every low-level unit as well. The labor and delivery unit, that's for moms who are coming in to have babies. So they pretty much take care of 1 or 2 moms that are in labor. They watch their contractions, make sure everything's going okay, and sometimes they help deliver the baby if the doctor can't get there in time. The mom-baby unit, that is for moms who already had their babies. They go to a different floor after that, and that's pretty much just making sure that both mom and baby are healthy, they're safe, mom learns how to take care of the baby, and all that kind of stuff. Pediatrics, that is for children that come into the hospital anywhere from 0 to 18 years old. So you take care of kids when you work on pediatrics. Med-surg, that is pretty much just any basic sickness. Someone who has heart failure or diabetes and it flares up, they get taken care of on that unit. Mental health, that could also be called behavioral health. That's for people who come in and they need to be hospitalized because they can't cope with life at the moment. They either have depression or some kind of mental illness like schizophrenia or bipolar disorder, and they get treated on that unit. Hospice, there could be either in the home or in the hospital. This is for people who are dying. Pretty much the main goal is to make sure that they feel no pain, they're surrounded by family, and all their needs are being taken care of, just to make sure that they're going to pass peacefully and surrounded by family. Home health care, A lot of the times nurses will come to the home after someone's discharged from the hospital. If they have wounds that need to be taken care of, they can clean the wounds out. If they need help with their medications, basically you go to people's homes. Once you visit the homes for the day, you're done. You don't have to work 8 hours. If it takes you 4 hours, you're done for the day. Nurses can also work in the operating room. So as a basic registered nurse, which I would be, you aren't actually assisting with the actual surgery. Most of the time you're watching the patient, making sure that nothing's left inside the patient. You can give the surgeon the scalpel, anything that he needs, and it's a lot of just making sure the patient is safe and charting. Every place that we've been over, a lot of the things that nurses do are medications and charting. Charting is probably the longest part of the shift, and that's just to make sure that you're documenting everything that you did for the day so you're covered. Nurses can also work on a rehab floor. This is for someone who had surgery, such as a hip replacement or knee replacement. They were in a car crash, so they need help learning to walk or how to be mobile again. So you're on that unit and you work really closely with a physical therapist or occupational therapist. Or you can work in the float pool. So basically this is for a nurse who has a lot of experience. Once you go in the float pool, you can float to any of the other units. You can go wherever, pretty much they put you wherever they need you. You've had experience in a couple of different places, so you're able to go work where they tell you to. So I'll do qualities of a nurse. What does it take to become a nurse? Nurses have to be caring. You have to care for your patients. Empathetic. You have to have close attention to detail to make sure you can notice any changes in your patient's condition. You have to be emotionally stable. A lot of the times these patients are really sick coming in. You have to have a good stomach. Sometimes you'll see blood or puke or pee. So you have to be able to handle all of that. You have to be able to be flexible. If the doctor says, give this medication, but then all of a sudden he's like, no, give this one, you have to be able to change really quickly and not really miss a beat. Hardworking. Nurses work very, very hard. They're pretty much standing on their feet 12 hours a day, taking care of anywhere up to 6 patients at the same time. A quick thinker. If something goes wrong, you have to know what to do right away to save your patient's life. You have to have good judgment. Basically, if someone says to do one thing, but you don't think that's right, you have to use your own personal judgment and knowledge to make that call. Physical endurance, like we said, you're pretty much standing 12 hours a day, working 12 hours a day, which is quite a long shift as well. And you have to lift the patient sometimes where you have to move them up in bed. So it's pretty much you and another person moving anywhere up to like 500 pounds. So you have to be strong too. And of course you have to be responsible. You're in charge of someone's life. You're making sure they're taken care of and safe. And you also have to have good communication skills. You have to be able to talk to your patients, talk to their family, make sure that you understand what they need and they understand what you're doing. Miscommunication could be fatal. So I will end here and we will continue on with my next video in just a couple minutes.